Most of the Western cheek augmentation filler procedure I saw were injection method using a sharp needle. Of course, in cheek augmentation filler procedure, the risk of meeting major vessel is not greater than other parts of the face. However, as I mentioned before, cheek augmentation does not necessarily mean zygoma augmentation in Korea. Not only zygoma augmentation, but it also contains malar augmentation or augmentation of lateral cheek depression, and sometimes mid-cheek augmentation are included. In particular, in my clinic, I do various mid-face treatments under the name of mid-facial filler rather than cheek alone. The closer to the midline of the face, the more chance to meet major vessels, for example, facial artery or infraorbital artery, and so on. Therefore, it is safe to perform the procedure with a blunt cannula, and a long cannula can be used with fewer puncture sites. Using a long sharp needle can cause relatively more tissue damage. Actually, filler treatment is very common in Korea, and the use of disposable blunt cannula is very common. That's why I use a blunt cannula for cheek procedure, and it helps reach as wide as possible with the minimum puncture site by maximizing the length of cannula. This is how I named it the hole-in-one technique. And of course, there must be several doctors performing this procedure already. Using a hole-in-one technique, you can reach zygoma, malar or tear throat, lateral cheek depression, and even nasolabial fold and anterior cheek. Especially for the nasolabial fold, it is easy to access restose space in this direction. In this way, most of the cheek area can be covered with a single puncture. Let's watch the cheek augmentation case using the blunt cannula. This is the picture requested before visiting the hospital, and she's a Caucasian woman who wants cheek augmentation. The right mid-face, little depressed. So we also need to correct the asymmetry. Pre-operative photo taken in the clinic. Now is the video. Marking the puncture site. Now I'm blocking the infraorbital nerve. This is not very effective for cheekbone augmentation only, but it is usually done for malar augmentation or nasolabial fold correction. First, injecting filler into the malar area, deeper layer with Epitico 500 via 23 gauge cannula. The cannula I'm using has a marking on every 1 centimeter, so it's good to keep track of the cannula tip's position. And always check the cannula tip using left hand. If it is difficult to advance the cannula when meets retaining ligament or other dense tissue, then pinch or stretch the skin with your left hand or rotate the cannula and advance it. For superficial layers, use Epitic 300. Tapping with left finger is for reducing pain. When the treatment is almost done, erase all of the design and compare bilateral sides and fix the rests. Occasionally, I let the patient hold a mirror and show it to the patient and fix the rest. And she has right depression, so inject more filler to right lateral and anterior cheek. Left is before, right is after. Right cheek depression has corrected, and zygoma has lifted, and the OG curve have became more prominent. There are many ways to perform cheek augmentation, but the filler injection procedure is increasing along with the trend toward simplicity and safety. Our doctors will have to choose a filler with safe and appropriate properties for good results. And also, there are many ways to inject filler, but I think the patient satisfaction will be even greater if it is performed safely using a blunt cannula and minimal puncture sites. Here's what I prepared. Thank you for your attention.